Namaste. Once again, welcome to Transform to Transcend. We hope you've been liking these editions of our show. We welcome you now to the segment called Wellness UAE. As you know, we've been discussing cancer all this month, and in our concluding segment on cancer, we are discussing how you can get back safely into your work life, into whatever it is that you used to do before cancer caused an interruption. Once again, we welcome Ms. Lalitha back, and this time we want to know how cancer survivor, a person who has gone through the whole process of the allopathic process, the chemotherapy, immunotherapy, surgery probably, how they can safely get back into the workplace or into whatever they were doing before, and safely and without causing stress and without causing any relapse.
Right. So one of the key things that they have to keep in mind is about what kind of job profile that they would be choosing again. So they would have taken a break from their work front and then gone through the treatment, and now they're going to come back to the work again. So coming back to work is again incorporating two different lifestyles. You have to incorporate the rehabilitation process, then your routine lifestyle, as well as the work front. So the stress from the work front along with the rehabilitation process have to be integrated very smoothly. So you would also be having your medications, so taking your medications on time is one of the requirements. Similarly, physical activities is another major requirement that even the doctors will ask the patients to continue under the guidance of a health expert or a yoga expert. So these are different activities which have to be incorporated in your day-to-day lifestyle along with your work front. So choose a profession or choose a profile which is less stressful, where you have a positive mindset environment. People are helping you, encouraging you, because you might in the initial couple of weeks or months you might feel tired, exhausting, hot flushes and things like that. So you need a boss who is understanding. You will want a peer who will understand your conditions and help you cope up with the situation. That's number one. Second is keeping your mind constructively occupied. So that involves not just your work, it is also involving your recreation activities. So as I mentioned earlier, hobbies, music is a therapy by itself. So music is a wonderful way of healing yourself. Similarly, various meditative techniques are also palliative for rehabilitation of cancer survivor. Along with that, association of positive family front. So not somebody who you've got back to work again. This is like a shock for the person again, and it's demotivating. So choose your people wisely, choose your family, choose your you have the choice to be with people who are encouraging you in your life. These are a few suggestions, along with certain other yogic disciplines which you might probably want to know as well. Yeah.
Definitely, because a big part of getting back into routine is all the tensions and stresses that come with it, and probably those are the stresses which got them into cancer in the first place, so you want to avoid them as far as possible. So how do you think yoga can help them in addressing those tensions that they might be facing?
Correct, you pinned the nail. One of the things that people miss out when they're at work is eating on time and sleeping late. These are two things which really is harmful for anybody. It's not just for cancer, any kind of psychosomatic disorders or psychological disorders. If you do not stick to your time of food as well as the sleep timing, the body is not going to heal. So that's one of the most important thing when you come back or when you survive after battle of cancer. It's very essential to follow the food routines and what you choose to eat. So that's also very important, because your your nutritionist is going to tell you that to avoid all kinds of canned foods and processed foods and things like that. So it's very necessary to follow those regimens very strictly. So more or less life is all about living a disciplined life. So whether you choose to do it, prevention is always better than cure. So you have to do it, to prevent yourself from having a relapse. These are the few disciplines. Then we have exercises.
Yes, that's exactly what I was going to ask. What about the asanas that probably they can do at the workplace, if they feel, and the situation is tense, or, they're not able to cope with something, then are there any asanas that you can suggest they can do at their desk?
Yes. So taking intermittent breaks from your work routine. So let's say, for example, if you're morning when you come and sit in front of the laptop or your desktop, the first and foremost is we are cutting ourselves from the environment where it's a home environment, and then we are traveling, we are driving, we are taking the metro or whatever stressful mode of commuting, and then we are entering a work environment. So you just sit in your desk, stay for a while, keep your eyes closed, breathe, do your breathing exercises to connect with your desktop. That's very necessary. Then you become, maybe you can you can begin your work, whatever profession that you're in, you can begin your work, and then take an intermittent break. Maybe your eyes are tired, you can do some eye strengthening exercises. Continue with your work for another half an hour, 1 hour. Then you can do your neck exercises where you will feel a lot of strain for those who are in the IT or into the desktop sitting for hours. Then they need to do their neck exercises, shoulder strengthening exercises. Maybe they want to stretch their spine later on. So after a couple of hours, again they would love to stand up. So don't be static in one place. That's the underlying principle. So get up, make your body move, because body is not a static entity. It is a dynamic entity. So we need to keep the circulation on. So that's the secret of a healthy work-life balance, if you want to call it that way.
Makes a lot of sense.
So we would love to share with you some exercises which you'll probably be interested to. Yes.
So thank you, Ms. Lalitha, once again for sharing your knowledge with us, and we hope that all of you have enjoyed this show and this last segment that we had on cancer. With this we conclude all our editions on this subject. But if you have any doubts, any questions, please comment below, please let us know, and we will have Ms. Lalitha again and we'll ask her to address them for you. Please like our video, please share them with someone whom you think might benefit from it, and until we meet again with another edition of Transform to Transcend, Namaste, and stay safe and stay healthy. Thank you so much.